Hello people, welcome to my channel Physio Guide by Divya. So today I'm going to teach about to remove secretions. What the physiotherapy do to remove secretions. This is the topic from the pulmonary rehab program only. This is the second one. Now what is this to remove secretions? What physiotherapy do? First one, coughing. Effective coughing. Next I'm going huffing. Next first coughing. Next huffing. So we'll read this. What is that coughing? That coughing means that cough comes from deep within lungs, force to carry out that mucus from the lungs. Cough with forceful reaction. That sound will come, no? So that is the cough. Now we'll read the definition. The coughing is the forced expiration coming out exploitation technique against a closed glottis. This is the main difference from coughing and huffing. In coughing, the glottis is closed. In huffing, the glottis is open. In this coughing, sound will come. A large sound will come. In this, only the air will, the forced expiration, the air will come only. Like that. In this, like this. This is a coughing sound. This is the huffing sound. Okay. Now, what is the aim of the physiotherapist? To clear secretions from the trachea and bronchi. This is trachea, and then this is all bronchi. No? From this, to remove secretions, the aim of the physiotherapy. In huffing, to remove secretions from lobar and segmental, lobar means, see, these are all bronchi, no? This is bronchi, and from this, it will divide, no, like this. This is a lobar, and this divided part is segmental. So from this segmental lobar to remove secretions, the huffing part. Now coughing clears the secretions from the central airways. Coughing from the central airways only, it will clear secretions. And huffing secretions are moved from the periphery, from the end periphery to the central airways. It will bring and it will allow the secretions to come out. The patient, now technique, how to do this coughing. The patient is asked to take deep breath, then tighten the abdominal muscles and cough. And then cough. The air is breathed is high lung volume and deep breath. Okay, in this coughing. In this huffing, the patient is asked to take deep breath in and tighten the abdominal muscles and like same only. But in this huffing through mouth, air is breathed in mid-lung volume to breathe in medium-sized. See, from this technique, the difference is, here we'll ask the patient to take deep breath, here normal breath only, and here cough and huff, and here air is a high lung volume and deep breath, here deep breath is taken, here normal air is breathed in mid-lung volume to breathe in medium-sized only through mouth. Huffing is done through mouth. Okay, now next one. In this, to remove secretions only, it will combine the forced expiratory technique, FET technique, ACBT technique, ACBT. These are all techniques are combined to remove secretions. Okay, now we'll see this forced expiratory technique. What is the aim? First of all, to mobilize the secretions. I'm explaining from textbook only. Before reading in text, once see this video. To mobilize the secretions from the periphery, means from the end of the airways, periphery airways to the proximal, means upper airways. The aim of the physiotherapy is to bring from the periphery to the upper and to decrease bronchospasm. Bronchospasm means that sudden constriction and narrow tightening of the bronchi. So there, as a result, there will be airway will be narrow airways. So the difficulty in breathing, okay, will take place. Now, what are the technique in this forced expiratory technique? What is the technique? Means the patient is asked to perform 1 to 2 huffs. First 1 to 2 huffs. Relaxed breathing. Next again once or twice coughing. Coughing must be done. Huffing is done from the mid-lung volume to low lung volume, so the secretions are moved from the periphery. Huffing should be done from the mid to low lung volume, deep inside. The coughing performed at high lung volume. So this, as we told, this is from the deep and clear the secretions from the central. So after doing huffing, the secretions will come to central airways. No? So we'll ask the patient to cough so that the secretions are removed outside. The relaxed breathing is to decrease or prevent bronchospasm. Taking breathing, they will decrease bronchospasm, they are saying, okay. The patient is asked to take medium size of air, breathe in, and followed by forced expiration through the mouth open. We have to take through nose and through the mouth open. The patient is asked to huff once or twice and then breath control. So you understood, no? First one 1 to 2 huffs, the next relaxed breathing 1 to 2, after coming 1 to 2 coughing must be done. So this is one technique and this is another technique. In this, the patient is asked to take medium size of air, next followed by forced expiration must be done. Next huffing 1 to 2 through mouth expiration. Next huffing 1 to 2 times, twice, and then breathing must be controlled. So after that, technique must be repeated till the secretions are reached to the proximal airways. This must be continued till it reaches the proximal airways. Then coughing of high intense to remove coughing must be done, as I told in the previous. This technique can also be combined with ACBT technique for more effective. So this must combine with ACBT technique for more effective. These all are connected to each other only. So once understand how to remove the secretions, next one, ACBT. What is ACBT? Active cycle breathing technique. The aim of this is to clear bronchial secretions only. This also. In less secretions, we'll ask the patient in position is sitting. More secretion alternate side lying combined with postural drainage also. We'll postural drainage position also. We'll keep in that position and we'll do this ACBT technique. Postural drainage will combine with all that percussions, vibrations, shaking. Those are also combined in this postural drainage. Now the time taken is 15 to 30 minutes. A technique. How to do this technique? ACBT. This is the important one you need to remember. ACBT is combined with thoracic expansion exercises. So this ACBT, thoracic expansion exercise, means it's a deep breathing exercises. In this deep breathing exercises, breathe in should be slow and deep inside. Next one, it must held for few seconds. Next one, breathe out is relaxed and quiet. This is a thoracic expansion exercises. Next one, breath control. Next one, forced expiratory technique. As I told, this technique, no. This must, so these all are combined with this, with huffing and coughing technique, okay. The patient is asked to perform controlled breathing, then 3-4 thoracic expansion exercises, as I told, then forced expiratory technique, as I told here. The techniques are performed initially with mid to low lung volume, and once the secretions had reached the proximal airways, then huffing and coughing with high lung volume done to remove bronchial secretions, as we all understood. Now self-treatment, encouraged to do on his own by helping him in emergency conditions and home program also. Home, we must teach them self, okay, but to do them on his own. Suction means to remove the secretions with the help of the pipe, like that. The aim to suck accumulated secretions from main bronchial trachea and pharynx. From there, the technique, how to do. The catheter is passed to the thin catheter is passed through the pharynx or nasopharynx, means from the nose. Nas is from the mouth, and can be done through endotracheal tube. This endotracheal tube from the mouth, and mouth also we can take from that, and tracheostomy tube from the neck also will take from that. This catheter on the other end is attached to the suction pump, and the secretions are sucked out. So I hope you understood this topic, how to remove secretions, effective coughing, huffing, forced expiratory technique, ACBT, suction, okay. Thank you for watching this video.